Hi, this is Dr. Revati S. Rajan, Chief Consultant, Maternal Fetal Medicine and Managing Director of Mirror Health, Bengaluru. I'm here to share my thoughts on the new OmiCron variant of the COVID virus. Well, this has been termed as a variant of concern by the WHO or the World Health Organization. This virus was isolated first in South Africa, and thereafter it has traveled across continents. We've found it being reported from different countries of Europe. It has also been reported from the United States of America, and we've also had strains isolated from our country, and we've had some positive cases from Karnataka as well. Now, what is so concerning about this? Well, it's highly infectious and it can get mutated really fast. So what if it's going to be very highly infectious? Well, if it's going to infect a large number of people, though the fatality rate of this particular strain is less, like most of the COVID strains, something like a 0.3 to 0.5%, the number of people who are going to get severely sick if the whole community is affected is going to be relatively a very, very huge number. And unless and until we are pepped up with an updated or an upgraded infrastructure, we will not be able to handle the severe cases. So what has been observed till whatever we know about this virus for about a month or so? Well, we know that considering that this strain can mutate really fast, I'm talking about the spike protein, the spike antigen with several proteins which can change, the sequence can change really fast in this particular virus, making it difficult for us to, devise vaccination and treatment strategies, which, mostly rely on, targeting this spike antigen. So we're going to have variations in this protein sequence, and so the strategies that existed earlier may not be very efficient to tackle the virus in terms of prevention and treatment, because we've had several antibody protocols also, looking at the spike protein. So what is it going to do to pregnant women? Well, we don't really know much about its effect on pregnant women, but what we can say from our experience from the second wave, to what Delta virus did, we know that many number of pregnant women were affected compared to in the first wave, that is in the second wave, and with the virus. And we also know that there were more number of cases of preterm births and stillbirths. And we also had a lot of these pregnant women develop complications like preeclampsia, which has been attributed to some kind of oxidative stress and endothelial dysfunction, in women who've known to be affected with the Delta virus. As a continuum, we do not know much about the OmiCron, but definitely we have to keep all these kinds of problems in mind. We have to also look at other things like, with respect to data on malformations, growth restriction, placental dysfunction. All these also have to be checked along with the other known factors known to be associated with the COVID virus. But what is being advocated is that the best thing to do for these pregnant women is to follow all the preventive measures, lay more stress on prevention, which definitely is more times tested. So it's something like you need to make sure that they are vaccinated, they follow the routine preventive measures like wearing the mask, washing the hands, avoiding too much of unnecessary travel, avoiding community gatherings. And this can definitely help in prevention of the viral transmission and restricting the disease. So to summarize, what I would want to say to all pregnant women out there is please do not panic during this pandemic. We are going to encounter several such strains like the OmiCron the Delta, the OmiCron, and those that who are going to, mutate really fast, those who are going to infect more and such things. But definitely there is no shortcuts to preventive strategies. Follow all the rules. Make sure you're vaccinated with 2 shots, with whatever available vaccine that you can access, because what is found is, whatever be the strain, vaccinations can definitely help to prevent progression to fatal or critical disease. So we're going to probably reduce that severe illness and also admission rates by vaccinating ourselves. Please motivate women who are aspiring to get pregnant to vaccinate themselves in the preconceptional period itself, and motivate other women who have missed their vaccination during pregnancy to vaccinate themselves during the breastfeeding period. This will definitely have more converts and definitely contribute to the reduction of the fatal cases. And follow all the golden rules of prevention. I'm reiterating again, wear your masks, make sure you wash your hands regularly, avoid community gatherings, avoid unnecessary travel unless it's really required. Do not travel. So these are some of the preventive strategies which can definitely help us to deal with this problem. I'm just hoping and praying that the new year definitely gives us the courage, making us more strong to deal with these kinds of new strains of the COVID virus, with renewed preparedness to deal with it, mostly relying on prevention. So stay safe, stay healthy. Thank you.